Now, let's talk about the uses of Opfolda 65 mg capsule, which is a glucosylceramide synthase, GCS, inhibitor. This medication is used in combination with another medication called Cipaglucosidase alfa to treat a certain inherited condition called Pompe disease. Cipaglucosidase alfa works by breaking down a certain substance called glycogen that builds up in the body due to this condition. Opfolda 65 mg capsule helps Cipaglucosidase alfa stay active in the blood, which helps it work better. It's important to note that Opfolda 65 mg capsule must be used with Cipaglucosidase alfa because it does not decrease glycogen levels when used alone. When taking this medication, it's important to follow the prescribed daily dosage and take it at the optimal timing recommended by your healthcare provider. Before starting your treatment with Opfolda 65 mg capsule, it's important to read the patient information leaflet from your pharmacist. Take this medication by mouth on an empty stomach, usually once every other week, 1 hour before the Cipaglucosidase alfa infusion. Swallow the capsules whole with only unsweetened beverages, such as water, or tea, or coffee with no cream, sugar, or sweeteners. Do not drink other beverages or eat food for at least 2 hours before and 2 hours after taking this medication. The dosage of Opfolda 65 mg capsule is based on your medical condition, weight, and response to treatment. It's important to use this medication regularly to get the most benefit from it, so make sure to mark the days on the calendar when you need to take the medication. If you miss your dose, ask your doctor or pharmacist right away for a new dosing schedule. It's crucial not to increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and will increase the risk of side effects. Make sure to tell your doctor if your condition does not get better or if it gets worse. If you experience headache, diarrhea, or dizziness while taking Opfolda 65 mg capsule glucosylceramide synthase, GCS, inhibitors, let your doctor or pharmacist know. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Most people who take this medication do not experience serious side effects. Although rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And if you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Opfolda 65 mg capsule glucosylceramide synthase, GCS, inhibitors, it's important to let your doctor know if you have any allergies or if you have kidney disease. This medication may cause dizziness, so it's important to avoid alcohol or marijuana, cannabis, while taking it, and to be cautious when driving or using machinery. If you are planning to have surgery, make sure to inform your doctor about all the medications you are taking. If you are pregnant, this medication should not be used in combination with Cipaglucosidase alfa, as it may harm the unborn baby. A pregnancy test should be done before starting this medication, and reliable forms of birth control should be discussed with your doctor. If you become pregnant while taking this medication, it's important to inform your doctor immediately. It's also important to discuss with your doctor whether this medication passes into breast milk, as breastfeeding is not recommended while using this medication due to the potential risk to the infant. It's important to be aware that Opfolda 65 mg capsule glucosylceramide synthase, GCS, inhibitors may interact with other medications, potentially affecting how they work and increasing the risk of serious side effects. It's crucial to keep a record of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. Always seek your doctor's approval before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Opfolda 65 mg capsule and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to act quickly in these situations to ensure the best possible outcome. It's important not to share Opfolda 65 mg Capsule Glucosylceramide Synthase, GCS, inhibitors with others. Make sure to undergo lab and/or medical tests, such as kidney function tests, while taking this medication. Keep all medical and lab appointments and consult your doctor for more details. It's crucial to take each dose of Opfolda 65 mg Capsule Glucosylceramide Synthase, GCS, inhibitors as prescribed. If you happen to miss a dose, make sure to consult your doctor or pharmacist to determine a new dosing schedule. When it comes to storing Opfolda 65 mg Capsule Glucosylceramide Synthase, GCS, inhibitors, it's important to keep them in the original container at room temperature, away from light. Avoid storing them in the bathroom, and make sure to keep them out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.